I will start over. Um, okay. Hello, everyone. I think I'm now unmuted. My name is Jody Allen, and I am the Robert Francis Eames Director of the Lemon Project, A Journey of Reconciliation. And I want to welcome you to the 11th Annual Lemon Project Spring Symposium. I want to share with you just our idea or our thoughts about what's happening in the Asian Pacific Islander community right now. So the Lemon Project stands with the rest of William and Mary in solidarity with our Asian and Asian Pacific Islander colleagues and students to say that anti-Asian hate is unacceptable and has no place at William and Mary. It is now my pleasure to turn over the panel, this afternoon's panel, Not Everybody Knows My Name, Negotiating Identities, to the panel moderator, Dr. Monica Gosen, Associate Professor of Sociology. Thank you again for joining us.
Hello, everyone. Thank you again for joining us. Before we begin, I would like to acknowledge the land that we occupy. William and Mary acknowledges the indigenous peoples who are the original inhabitants of our lands our campus is on today. The Cheranhaka, Nottoway, Chickahominy, Eastern Chickahominy, Mattaponi, Monacan, Nansemond, Nottoway, Pamunkey, Patawamek, Upper Mattaponi, and Rappahannock tribes, and pay our respect to their tribal members, past and present. So let me introduce our speakers for today. We are talking about Not Everyone Knows My Name, Negotiating Identities, Questions, and Biographies. And today we have with us Michelle Harris and Angel Hawk. Michelle Harris is a compassionate motivator who has coached hundreds of women into life-altering breakthroughs and deep introspection that propels them into a new ways of existence. She is the founder and CEO of Anew Health Solutions, PLLC, a community-driven self-care safe space for Christian women who need a spiritual refill after pouring everything they have into other people. She has authored 2 books of Healing from Invisible Wounds and The Stress Factor, and stands as not only an expert on stress management, but she also provides holistic counseling and life coaching to ensure her clients achieve mental, physical, and spiritual wellness. As a wellness coach, Doctor of Behavioral Science, licensed clinical social worker, and minister for more than 15 years of experience, she supports Christian individuals and families in their quest to unlock themselves from the mental chains and invisible wounds of anxiety, suicide, depression, and stress. And our second speaker, Angel Hawk, MSW, is a mental health therapist specializing in treatment for individuals, families, and groups in crisis. Hawk's focus is working with various target populations, including adults suffering from substance abuse, adults with significant disabilities, and foster care families. Angel Hawk graduated from South Carolina State University with a bachelor's in social work and continued to study clinical social work and organizational community planning at the University of New England, earning her master's in social work. Angel Hawk currently facilitates substance abuse groups at a psychiatric facility in South Atlanta. And she is originally from Chesapeake, Virginia. So I will go ahead and turn it over to our first speaker. We're very happy to have you here with us.
Thank you. Now, who is the first speaker?
I think you guys, that's a good question. We can go in whatever order you would like to go in.
Okay, well, I'll go ahead.
Sure.
Fine with you? Okay. Well, thank you all so much, and good afternoon, everyone. I'll go ahead and share my screen. Are you all able to see this?
Yes.
Okay, great. All right, so I wanted to share with you all again. Thank you all for having me here this afternoon to be able to share with you all about Nobody Knows My Name. And I am tasked to talk about the Black Superwoman syndrome and how to go from strength to strength. And as you can see from this picture, that we have this beautiful lady who, with her Superwoman cape on, she's ready to go. And we just think about us being as strong women and strong Black women, how we can go from strength to strength. And the purpose of this is to provide insight of how the stigma and disparities that Black women also often deal with due to perceived stereotypes, and to also provide strategies to promote wellness and how we as a community can come together to help Black women to heal as a whole. So let's just begin to talk about the definition of what Superwoman is. You think about many times just in casual conversation when you hear about, she's strong, or, feel like she's a Superwoman, she handles everything. And it is defined as a woman who is usually strong or intelligent, or who can do something extremely well, especially for a woman who has a successful career and also takes care of her home and family. And then, as I wanted to bring out this quote here, and it says, Black women had to have developed a larger vision of our society than perhaps any other group. They have to understand white men, white women, and Black men, and they have to understand themselves. When Black women win victories, it is a boost for everyone, virtually every segment of society. So I just want to break it down from a historical context, societal context, cultural context, and family system context, and a personal context as well, of how this concept came up of being the Superwoman, Black Superwoman. So let's just talk about from a historical perspective. Think about it. Back in history, childbirth in Africa was seen as a rite of passage for women and earned as increased respect. So if you were able to give childbirth, it was definitely a rite of passage, and you had a lot of respect in the community because you were able to birth a child. And then think of many times in you go back to slavery, where many of our families were separated from our homeland, and many other matriarchs rose during slavery, but not just for their family, but also for their master's family. They took care of many of the chores in the home, of the children, and many times they had to witness many killings, emasculations, beatings of their husband, men, children, and family. So many times our African American women had to have increased roles, not just in caring for their families, but also for the masters and their children as well. And many times they were forced into labor as men on farms as well. So they were forced into labor, doing a lot of things, and had to do a lot of things to take care of the family. Also, Black women were innately viewed as lustful and hypersexual by white counterparts. And think about also with Caucasian women were viewed as pure and modest. So they had to bear the backbone of caring for the family, caring for the household, and often viewed as hypersexual, sexualized, raped. And many times white slave owners will often tear slaves from their families so they could be able to nurse their babies instead. So also, from a historical context, occasionally Black slave women were engaged in sexual activities with their masters for possibility of their self or children to be liberated. And many times they dealt with a lot of rape. Many times they were coupled with other Black slaves to have forced sex relations for economic gain. And many times, many of these Black slaves were not able to file charges of rape against white men in those southern states, made it legally possible for slave women to file rape charges against a white man before 1861. So from a historical perspective, you see a lot of things have led to the strength and a perceived notation of what Black women needed to be. And many times rebellion acts on occasions were put on responsibilities of children before they own, and many elderly women were revered. You think about Harriet Tubman. She was a very strong woman who aided slaves to freedom through the Underground Railroad. And I wanted to bring out this case of 1855. She was executed, Celia. She was executed for killing her white slave master due to years of rape and was not allowed to speak at her own trial. So, and then we think about this book by Ida D. Wells. It was published, the Wells Campaign, and it was called Southern Horrors. And it marked a renewed campaign on the part of Black women for sexual justice and fought during Civil War era. So it has been a lot of strength from a historical perspective of how this concept of being a strong Black woman has evolved. So let's just look at also the societal context. Racial and gender wage gap. You hear a lot of many times of how Black women may have the same job as their counterparts, but do not get the same salary. There's a huge salary disparity between Black women and their counterparts. I even read an article on yesterday on how they're not, you look at governmental jobs and many type of positions, how many Black women aren't presented in those higher up positions as well. And you think about also with the pay gap and rising, how Black women often earn 66% of every dollar earned by white men, amounting to almost $23,653 less in earnings over an entire year. And then over a 40-year career, this translates into a lifetime earnings of $946,000, 120 between Black women and white men. So you look at this from a societal context that many times that Black women have to get the higher degrees. You have to make sure that you have everything on point. And even though that you may be at a place where you have the qualifications, you have the degree, many times there is still a wage gap and gender gap with being able to be paid equitably. So you think about also racism and gender discrimination among workplace and school institutions has initiated social anxiety. You think about racism, you think about women who had to fight to even wear their hair, to certain places and having to have discrimination against that. You think about social anxiety of being critiqued, many times seen as angry when we're trying to justify certain things or certain situations. Many firsts, we are still in this 2021, but yet we still having first Black woman to do this, first Black woman to succeed in this. We're still having these many firsts and limited cultural competence of how we communicate, how things are, and how we are able to communicate with others as well. So there are professional disparities as well, that many times we have to go to a workplace and they will say, oh my gosh, you have that time, many times they say, oh, she sounds professional. And professionalism meaning that they may sound like they are Caucasian counterpart. So dialect, many of things that has to be changed because of Black women are having to adjust to society and professional disparities that are often presented. And then think about healthcare disparities from a societal context. Many times they have the highest pregnancy-related births, but also adequate access to healthcare. And I know many studies have been shown that many Black women have a high rate as well of birth-related deaths because of not being able to get the necessary treatment that they need. Also not being able to have communication and doctors really truly understanding their bodies and how to be able to treat medically. So there is oftentimes a lack of cultural competence among providers and a lack of trust to seek mental health treatment of who they can really trust. And also increased suicide rate. Even though we may have a decrease of suicide deaths, but from age 13 to 19, it has risen from 182% from 2007 to 2017. So we often looked at that we have to be strong, and that being strong was, often need for times to survive, just be able to make it. I even talked with my mom. My mom was like, we just had to make it. We just had to do. It was no question about it. You have to just keep pushing. So even though you had obstacles, even though you may have wanted to say something or you wanted to fight, you just had to take it and you just had to keep pushing. So when you think about that, it was oftentimes a need of survival and a perceived positive trait. You think about times even, and I shared a story about this young lady before that shared a story on, that she was at her mother's funeral and they were talking about how strong she was because she didn't cry. But she said inside that she was so torn down, but she felt like not being able to cry was perceived as being strong. And then also think about faith plays a major role and often the first source of strength, and that the lessons of strength were often gleaned from our foremothers that they taught us. And so I also think about from a cultural context, that large majority of white and Asian children live with married parents. And by contrast, only 31% of Black children, African-American children, are living with married parents in the household. And more than 54% are living in a single parent household. Also, Black women are more common to be in single motherhood and are the breadwinners of the home compared to, as you can see here, compared to Caucasian and Hispanic, that many our Black women are considered as the breadwinners of the home. And this is here just a chart that I just wanted to show briefly of how, as far as with marriage, how it is compared with parents in first marriages or remarriage, and how it is a disparity between that as well. However, there is a placement and within the African American community to push forward towards to get education and to push oneself to be able to move forward. So even though that there may be, a one-parent household, there is a strength wherein there is a push for children to be able to go to school and continue to do things and to be high achievers. So we'll go on with that. I talked about the childbearing as well. And then also, I talked about also with the mothers and the low income families that there is a push. You will see 62% will push for their children to be able to go to school. They will push for them to have a higher importance on having a college degree. So there is a strong religious orientation. There is a high aspiration rate, and that the role exchange that women, strong Black women, they're unafraid to support their family if men aren't able. And then extended family is very important in the Black community, that, your cousins, the family in the neighborhood, those within the church community, they are very important in the Black community, and the willingness to work. That many of women will have 2 or 3 jobs to take care of the family, to make sure that food is on the table, to make sure that the family is taken care of. So the matriarch is the backbone of the family. You think about the grandmother. My grandmother was the strength and able to handle multiple responsibilities despite the limited resources. My mom was able to make plenty to happen with little. And even though she may have struggled, we didn't even see it because she somehow made things work. And so I also talked about the strong faith is a strong connection to help through difficulty and manage daily life as well. So you think about from a personal context, personal beliefs, to maintain inner strength, obligation to suppress emotions. As I talked about the young lady saying, that she was taught to, that she was so strong because she was able to hold in her emotions, through the death of her mother, even though she was on the inside, she was torn up. We focus on independency, taught to, take care of yourself, to be able to manage, to be able to help others as well. And it says here, Black women fight with strength, with strength. They manage unfair claims as though such were legitimate. However, on the other side, categorical expectations are enforced silences. So we fight with the strength, many of the unfair claims, things that we need to be able to have handled. And then also perceived weakness is to discuss vulnerability. If you do be at a place wherein you feel that way, that you at a place where you want to cry, or you at a place, you are considered weak. But the traditional roles are changing. And even though, that many of them are, people are working outside of the home, and traditional roles have changed, it's still up in the culture to handle those and manage the household responsibilities. So there was a study, and I just want to share this study here, and it was a Superwoman schema, and it was an African American's view of stress, strength, and health. And the study was developed and interviewed, focused on a diverse of African American women, and they categorized their Superwoman role and personal, socio-historical, contextual factors. So they talked about different things, so their role perceptions, benefits, liabilities, and how it influences their health. And they reported that the benefits was that they had a perseverance of self, a family, and community, but the liabilities that it had a lot of relationship strain, stress-related health, and stress embodiment as well. So many times Black women suffer in silence, appear to look and perceive strong, is revered, but they are often exposed to trauma-related system and historical stress that is often rarely addressed. And that helps to push forward with the lack of personal, intimate connections, because I have to be strong. I have to continually push through. When they ask me how my day is, I have to continually say that I am well. So you have to think about utilizing other means to cope with stress and disappointment and abuse of things that has been dealt with before. This is also an impact on personal beliefs as well. Poverty levels also as well, suicide rate, socioeconomic status, and all these hidden wounds all affect as well. So I'm gonna go through here, and I said, despite of the obstacles, just think of all us as Black women, African American women, have pushed through. All of these people, these names that I have here, from Harriet Tubman, Oprah Winfrey, Dr. Michelle Obama, Dr. Maya Angelou, and then you can put your name here, that we have been able to go from strength to strength despite of these obstacles. So I would just like to ask, the question may be, okay, so you've given some of the historical context that I've just been able to kind of go through and push through the historical, contextual, and personal context. So where do we go from here? So I would just say to you, if you are at that place, and if anyone has been at that place, that now it's time to surrender your cape. We do not have to be superwomen. Know that self-care is vital. If we want to be able to be our best for others, if we want to be able to be that best mother, we want to be able to be that best professional, we want to be able to get that degree, that we know that we have to practice self-care, and it is vital. And know your stress triggers. Placing yourself on a priority list, that we have to make sure that we get our regular visits, annual visits, and communicate with the doctor. Get with a doctor that you know that you can trust. Do not give up. If you go to one doctor and you feel like they have not been able to help you, go to someone else and utilize your available resources. And do not be afraid to yell for help. Do not be afraid to say, listen, I need help. Maintain a close circle that you can depend on, and never ever feel like you have to lose your shine in caring for others, knowing that you can be able to be who you are while you're caring for other people. So do not forget that you have to put yourself, and then also be an advocate. When you're communicating your needs for others, research, do whatever you need to do to invest in your care. And enjoy the simpler things in life. Like I told a client earlier today, stop and smell the roses. And know it is okay to stand out and be you, and show genuine concern, and set those boundaries if you need to, and switch up your normal routine. take a bubble bath during the week and just sit back and listen to your favorite music, watch your favorite movie, do something different, take a different way to work. These are things that you can do to take care of yourself, to say, I don't need to have to wear this cape, that it is okay to not be okay. I can allow myself to release. And know that as a family and social circle, that it is better to get along as a team, that it is better to show genuine support, that it is better to create memories and new experiences with others, and know that life is too short. And if you have any broken relationships, even if it means to resolve the relationship, but go ahead and make an amends. Do not carry those burdens and those things. And then an attitude of genuine gratitude goes a long way. And if you see someone hurting, if you see someone at that place, help that sister out. Give compliments to one another. Let's support one another. Give flowers and let them know. And expand your cultural awareness. Connect with others from various cultures and learn and grow from them as well. And from a professional perspective, I encourage those to learn cultural competence, to show genuine support and concern, learn about your coworker, your colleague that you're working with, and be able to address those inner racial stereotypes that you may have. And as a community, that we are better as one. Address those stigmas associated with mental and physical health. Faith-based organizations can be more actively involved in wellness as well, and develop a network of genuine support, and also educate seminars on African-American women's holistic health as well would be very important. I also attached some resources here that I can send this out to you all if y'all have any questions. Here are some more resources. That's my references here. I am at my time, so thank you all. This is my contact information. If you have any information or questions, feel free to contact me. Thank you so much.
Sorry, I was speaking and not on mute. Thank you so much, Dr. Harris. We're really excited that we got to hear from you about this really important topic. And I wanted to just remind everyone, if you have questions, you see in the chat that you can put questions there. We're going to hold questions till the end, but I don't want you to forget the questions that you had for Dr. Harris. So as you're thinking of them, you can feel free to put them into the chat. So we're going to go ahead and turn over the floor to Angel Hack, and I'll hand it over to you.
Good afternoon. My name is Angel Hack. Before I get started, I just wanted to say thank you to Dr. Michelle. I really enjoyed your presentation. Thank you for sharing that information with us. I would also like to say thank you for inviting me to share this space, the Women Project, Women Marry. Today, we're going to talk about generational trauma, lynching, and in the Black community. So going to the next slide, we're just going to talk a little bit about the overview of what we're going to discuss overall. So we're going to define mental health. We're going to talk about complex trauma, epigenetics of trauma. We're also going to define generational trauma. I'm going to use a WPA slave narrative from Lizzie Norfleet. We're also going to talk about racialized violence in Mississippi. We're going to talk about the social indoctrination of racialized violence, and we're also going to talk a little bit about Catherine Bailey. And we're also going to talk about, is this my story in particular? And then we're going to talk about some skills for you to practice, the summary and conclusion. So going to the next slide, what is mental health? And for this slide, I included a quote from Lauryn Hill. And the quote just says, that strong mother doesn't tell her cub, son, stay weak, so the wolves can get you. She says, toughen up. This is the reality that we are living in. I included this quote in particular because it speaks to the Black experience in reference to what we try to get our children ready for in terms of being able to be resilient and be resistant and also open to the world around them as well. And so sometimes we don't want to inflict more trauma by transferring our personal experience onto them, but we definitely want to give them the best of what we have. And so this statement was a way to connect the pieces of what we want to be able to pass down to our children in terms of resilience, and at the same time being considerate and open to the generational pieces of trauma, to be open to healing those spaces as well. So mental health is defined as the individual's ability to think, emote, and interact with each other. Violence and persistent socioeconomic pressures are recognized risks to mental health. So going to the next slide, we're going to talk a little bit about complex trauma. So complex trauma is a little bit different because we're talking about a traumatic event where you're still experiencing the symptoms of that event past a 30-day window. So complex trauma is typically when you're experiencing a traumatic event, but you're still struggling with that event beyond 30 days. So typically things that classify as a complex trauma would be generational trauma, but that's not classified under the DSM-5, but a diagnosis that people are typically more familiar with would be post-traumatic disorder, which would be classified as a complex disorder. Acute stress disorder would be a similar thing, but it more so focuses on a traumatic event that an individual experiences. However, it would be within a shorter window of time, which would be 30 days or less. So complex trauma refers to emotional dysregulation, multiple or prolonged traumatic events, psychological maltreatment, neglect, physical and sexual abuse. Going to the next slide, we're going to define generational trauma, transgenerational trauma. So transgenerational trauma is defined as the transference of emotional and physical pain from one person to the other. The transgenerational effects can be familial, social, cultural, neurobiological, and genetic. And with this, we're going to illustrate transgenerational trauma in connection with the WPA slave narrative from Mississippi in order to look at the systemic ways that transgenerational trauma can affect a person. So going to the next slide, we're going to talk about epigenetics of trauma. The study that changes, the study of changes in organisms caused by modification of gene expression, epigenetic alterations associated with the perception of trauma transmitted through germ cells, molecular mechanisms, and trauma influences individuals and their offspring. So what that means is this raises the possibility of direct biological transmission of the effects of trauma. However, the appreciation of the complexity of the human experience and growth cannot be simply reduced to DNA alone. So the next slide we're going to go to is going to be a WPA slave narrative from Lizzie Norfleet, who was from Mississippi. And I want to start off with a quote that I pulled from her WPA narrative, which is, "If a slave died, there was no Christian burial, but the box with the corpse in it. All the slaves went to the grave, and from there they went back to work. There wasn't no song, no prayer, no thing over the dead." So if you notice in this quote in particular, which was taken from her WPA narrative, this was a source of inspiration for me to be able to tie in systematically her experience with slavery in reference to how we understand trauma and how that can be passed down as she's also telling her story. So her age is unknown in the WPA narrative. She estimated her age based off of her occupation and the Civil War. And this was based off of her being able to carry 25 gallons of water to field hands and driving a mule. So based off of her occupation and the Civil War, she estimated herself to be about 12 years old at the time. She also talked about that there were no chains on the plantation. However, her uncle and a crippled woman still managed to attempt to escape. And the slave owner encouraged all the slaves to be good and cited his own Christian beliefs. However, there was no church in sight on the plantation. And one of the things that was also interesting about this WPA narrative from Lizzie Norfleet is that when slaves typically ran away, they didn't always run to the north, but they hid in the woods instead. So going to the next slide, we're going to talk about psychoanalytic theory. So psychoanalytic theory was created by Sigmund Freud. He is the father of psychoanalysis. Psychoanalysis is the combination of theory and technique to connect the unconscious mind to the conscious behavior. An example of this would be, a hypothetical example would be a 35-year-old person. They had cats. They have a hypersensitivity to smell. They can't be in the same room with cats. However, they cite a traumatic experience that happened to them when they were 6 by being scratched by a cat. So the connection to understand psychoanalytic theory would be connecting the adverse childhood trauma when this person was 6, being scratched by the cat, and connecting them to the current state of where they are as a 35-year-old, having an extreme hypersensitivity to cats, not being able to be in the same room with them, can't tolerate the smell. So psychoanalytic theory connects the current circumstance of the client and being able to connect that to the adverse childhood experience and being able to note some of the symptoms associated with that. But to talk about a little bit more about psychoanalytic theory is talking about three components, which is the id, the ego, and the superego. So the id is defined as the pleasure principle. It's the need satisfying, tension reducing activities. The ego is classified as the reality principle. The superego is classified as the spirituality or high moral. So if you look at the picture of the iceberg, you'll notice that there's a portion of the iceberg that's just above the water, and it's identified as the conscious. And then you see the rest of the iceberg just below the water, which is identified as the unconscious. Right below the water, you see all three segments that are pretty clear in how they're all connected to the superego, the ego, and the id. But just above the water, you notice that you see more of the ego portion poking out, as well as the superego. So in order to understand this picture, it's to understand the different segments of the brain and the mind and how we tend to rationalize our decisions. When you think of the ego, it's more of our everyday decisions, the things that we say yes to and the things that we say no to. The superego is more of what we aspire to be in connection, our spirituality and our high morals and our beliefs. The id is more of the unconscious part of our brains that's more suppressed, that has more of intrusive thoughts associated with it, but it still is connected to the ego and the superego. So it still has some level of influence on our yes and no decisions. It still has some level of influence in terms of our superego, but right above the water, what you see on a day-to-day basis is our ego and our superego and how that affects our day-to-day decisions. So going to the next slide, there's a song that I want you to listen to. When understanding lynchings, one of the commonplace things that happen in lynchings is playing church hymns. This was one of the hymns that was played at a lynching site in Mississippi. This church hymn was played in Mississippi in 1915 for a double hanging of Deep Seals and Peter Goldman. They had confessed to their crime, and before they were being lynched, the story was read in the newspaper that they requested for this song to be played while they were being lynched. White correspondents and witnesses choose to remember and record Black confessions in these ways itself is significant. So the story of this lynching that happened in Starkville, Mississippi was recorded from a white journalist who typically was attending the lynching at the time when it was happening. So what you find is that when you're reading newspapers that document lynchings, they're telling the story from a perspective where it's cropping out a lot of the physical violence that occurs prior to the lynching, a lot of the community intimidation and the community involved violence that's associated before the person is even lynched. So going to the next slide, we're going to talk more about the social indoctrination. So again, what you heard was a church hymn, which is "There is a land of pure delight." So again, the way this story was recorded in the newspaper is that the people being lynched, they wanted this song to be played, but because a white journalist from Mississippi documented the story in that way, it's still up for speculation in reference to how true that could have been. But that was a part of the normalization in order to allow people to disconnect, to normalize what they were seeing as to be appropriate and justified. So another thing that was also happening is combination words that were being used at lynching sites as well. So different statements that we use on a day-to-day basis, like "look, see." We typically use these on a daily basis, but we don't think about where they came from. But this was also one of the language pieces that were used at lynching sites. So you can look at the violence and the gore of what's happening to a person, but not see the humanity of the person. And all of this was to create a social numbing effect for communities to be able to participate in extreme violence and brutality of a person being lynched and be able to emotionally disassociate from that event. Going to the next slide. So there's a person that I would like to talk about today. Her name is Catherine Bailey. She was important to the lynching that occurred in Marion, Indiana. Going back to the slide, well, not physically going back, but the slide that we talked about in reference to the lynching that occurred and the song was being used, there was a photo also being used in that PowerPoint that was a part of a lynching that happened in Indiana. So there was a lynching that happened in Indiana that she was involved in terms of advocacy for the 3 men that were brutally abused by that community, but 2 people were lynched. And she was involved with forming the NAACP branch in Marion, Indiana. She assisted James Cameron to find legal representation. She coordinated national attention by writing letters, using telegraph and phone calls to locate to local and national NAACP to address violent racial crimes in Marion, Indiana. She won the Madam C.J. Walker Medal of National Honor given to the person who has done the best work in the NAACP during the year of 1931. I wanted to include her in my presentation because so often when we think about lynchings, we're not connecting the female involvement in terms of advocacy. We're just seeing the extreme outcome of the lynching. And there are times where the woman involvement appears to be background and instrumental. But for the lynching that occurred in Marion, Indiana, there were supposed to be 3 people that were lynched, but there were only 2 people that were lynched. And James Cameron was physically abused by that community, but someone in the crowd yelled that he didn't do it and to let him go. And so they released him, but he ended up writing a book about that experience. But Catherine Bailey was able to be instrumental in creating his advocacy team to be able to talk about his story. So one of the reasons why I wanted to include her in that is to be able to connect the story of the racialized violence and how African-American women were still instrumental behind the scenes to continue for people to have a national view on what was happening in order to make sure it didn't happen again. So going to the next slide, is this my story? It is your story, because when we're talking about racialized violence in the African-American community in terms of lynchings and how that could be the start of generational trauma, that includes a level of truth in storytelling, which can be unsettling and hard for people to listen to, but is necessary to listen to, which also includes a level of empathic listening. And the scope of our story includes inequality, collective experience in terms of talking about the pain that's associated with our community, but also in terms of the advocacy and resistance and resilience that we have in our community, in terms of the resistance in the face of violent intimidation. And so when you're talking about racialized trauma, in terms of lynchings in the African-American community, again, those stories can be unsettling, but they're necessary to talk about because the transaction of being able to hear those stories for what it is and be able to put that in combination with empathic listening is an act of empowerment. The difference between power and empowerment is the same equal access to power. And so when you're talking about power in itself, you're looking at someone who has all the access and someone who has none of the access or very limited access. Empowerment is when both parties have the equal level of access at the same time. So when someone's able to talk about their story for exactly the way it is and talk about their emotional attachment for the way that it is, and the other person is able to demonstrate empathic listening and to not try to mold the story with what they want it to be, but believe the story as it's being told to them, the transaction of that is an act of empowerment. Going to the next slide, skills to practice. I am right versus emotional intelligence. Understanding the difference between emotional intelligence and am I right is important because, again, when you're talking about a traumatic experience, whether it's a historical event like lynchings or whether it's a current traumatic event of something that might have happened in your family, you want to be mindful of the emotional reactions that you might tend to have or the ones that you tend to push down. Sometimes if you find yourself having a imbalance of wanting to be too objective in the moment, that could create a disconnect depending on if the person that the trauma could have happened to, and if they're sharing their story with someone who is also being very impersonal with them and they're focusing on the facts, objectivity, I'm right, that can create an emotional disconnect and it could run the risk of causing more harm versus having emotional intelligence to know that the action of what we're talking about makes me feel embarrassment, makes me feel anger, and being conscious of the action connected to your initial emotion and what are your thoughts associated with the emotion and the action that's happening. All of those pieces in terms of your action, your thought, and your emotion and how all of those things connect, overarching pieces of that is to be able to have the emotional intelligence and the self-awareness to tune into those things and how you're reacting to that. And empathy versus apathy, it can be a struggle to be able to sit with someone, to be able to listen to their story, because if you're listening to someone else's story and you might not necessarily agree with it, but you want to be able to hear it as it is, the demonstration of empathy is being able to believe the story as the person is presenting it from their perspective and allowing that to be what it is. And trying to understand that story, ask questions, but you're still allowing yourself to be emotionally available as that story is being told. And the last one, acceptance is not permission. Sometimes it could be hard to listen to stories of lynching and slavery and Jim Crow because, listening to that story and me not saying anything, listening to that story, what statement does that make about me? Does that mean I accept it? Does that make it okay? Do I disagree with it? So sometimes the silence associated with just listening to the story can be extremely uncomfortable for some people. And so it's important to understand your relationship with you being able to be in that space of offering listening, and your listening doesn't mean that you necessarily agree in that moment.
Okay. Thank you so much for, oh, did you have one more? You put yourself on mute, so I wanted to make sure.
And so in conclusion, the summary of what we discussed is we talked about some skills for you to practice in reference to how to sit in a space of empathy when you're listening to a story. Listening to the story doesn't necessarily mean acceptance or permission, but you want to evaluate your relationship to the silence and how you feel listening to stories that may trigger you in some spaces and being able to do your own internal work with that. We also talked about the connection of racialized trauma and lynchings and wondering, is this my story, and how it has a personal connection with me in terms of resilience in the face of violent intimidation. We also talked about indoctrination. We talked about WPA slave narratives from Lizzie Norfleet. We talked a little bit about Catherine Bailey. We talked about transgenerational trauma. We talked about the epigenetics of trauma, complex trauma, psychoanalytic theory, and we also defined mental illness. So the final slide in conclusion, a people without a positive history is like a vehicle without an engine, Steve Biko. Thank you, and I appreciate the invitation.
Thank you so much. Sorry to cut in there. I wasn't sure if you had put yourself on mute, so I wasn't sure if you had finished. But we're so glad to hear from both of you about these really, really important topics. I mean, they connect so well. And I think one of the themes that really resonates and seems to come out of here is this whole idea of humanity and having Black people's full humanity being recognized. And it looks like, we're able to think about that and thinking about Black women in the Superwoman role and all the things that you said, Dr. Harris, at the end about trying to disrupt some of that. And the same thing with, I thought was really fascinating, Dr. Hack, about this whole idea of the way that we listen and we sit with some of this pain, thinking about that. So from here, I wanted to go to some of the questions that we have from the audience and get a conversation going. And so there's a few questions here that are for both of you and some that are just for individuals. So I'll just start from the beginning of the questions we have, and I'm sure some others might be coming in. So this one is for, I'll just use your first names here if you don't mind. This one is for Michelle, and it says, you spoke about some ways that Black women can surrender their capes. What advice do you have for Black women at universities or other institutions who are being pulled in a lot of directions because they are Black women? So what are your thoughts about this question?
Prioritize. Definitely get, if whatever priorities that you have, some assignments may not be able to be accepted, and that's okay. Many times we have a hard time saying no, or we want to be able to have the opportunity, but you have to think about taking care of yourself. And when you're saying being pulled in so many directions, being able to set those healthy boundaries, it may not need to happen right now, or it may be a project or committee that you may not be able to be on at that time, but definitely prioritizing and really seeing, okay, what is it that's really pushing me? What is my why for doing this particular project? What is my why for going to this committee? Is it, what is the purpose for me really doing that? But really, truly, I cannot, if anything that COVID-19 has taught us is to really take care of ourselves, and life is so short. So if it's to a point where it's taken away from you mentally, physically, emotionally, and physically, then it may not be able to be at a best point for you at this time. So really, truly at a place where you really prioritize, really sit down and say, okay, what is a realistic schedule for me? And really take that time to incorporate self-care daily. I don't care if it's 5 minutes, 10 minutes out of the day. Turn your cell phone off. Go for a walk. If you're at the university, go away for the university for lunch. One thing many times what people do is they're sitting at their desk eating lunch. That's not a break. If you're at your desk and you're eating lunch, you're working. So you have to physically take yourself to go take that time away and celebrate whenever you have done something. Take that time to celebrate the small things that you have done. If you were on a project, and you were able to do something and it came out well, celebrate those things about yourself and really do those things to really take care of you. Make yourself a priority.
And there's a follow-up to this that I think, is really relevant. It says, how has the COVID-19 pandemic impacted Black women's stress levels and self-expectations? And I know there's been a lot in the news about how women are being affected even more so than men in some ways because of the caregivers of children and all of that. So what would you say is specific to the Black women's experience related to COVID-19?
A lot of trying to manage the day-to-day activities. Like I think I talked about before that many of us are single mothers. It's a high percentage of us that have to be strong. It was a writer, I don't know, she was a writer for This Is Us. I don't know if you all knew about her, but she was a well-known writer for This Is Us, the main show that people watch a lot, and she committed suicide. Mentally, we try to just handle things and just go and not sit back to really take things in. And I think it has been an increase. I've seen an increase of African-American women and men too saying, okay, I need to kind of talk about some things, because now they're sitting back and saying, I've been gone so much. So now I have to sit back and think of, okay, what was I really doing with my life? What was really important to me at that time? And that's what I have seen a very much increase in, with them seeking more mental health treatment like never before, which is a good thing. Mm-hmm. But it's also another thing we're in, you're adding in the additional stress that was already imposed upon, us. So, yeah.
Definitely. Angel, someone from the audience is really, they really reacted to the hymn that you played and said it was so powerful. And have you found examples of other hymns that were requested to be played at lynchings? Playing that hymn will be a powerful teaching tool, they said, and they thanked you for sharing it.
Well, I appreciate them highlighting that in terms of the connection of the church hymn. And the reason why I included that is because I wanted to talk more about how lynchings were a community social event and how there was a religious connection to the violence that was happening in order to create the disconnect for community spaces for white people to sit there and watch somebody be physically humiliated and taking parts from them, and to think that there's a higher moral ground for what we're seeing. And so, the humanity of that, to be able to sit there and watch these people get torn apart by their own community of people that these Black people might have worked for or that they've known. How do you connect those pieces, and what was being done in those settings in order for people to normalize it? So it required some deep digging in terms of reading into stories that were documented from newspapers about lynchings and what was being played in terms of church hymns. Now, that's the only one that I was able to find, but I felt it important enough to be able to connect for people. But personally, I was kind of hesitant to put it in there because I didn't want to traumatize or shock anybody in response to putting the church hymn in there. But I wanted people to understand that for some communities, there was a religious tie-in to lynchings and what they were doing to normalize it. And when you fast forward to the disconnect of white supremacy today and generationally, how those things connect, I wanted people to make those correlations.
Mm-hmm. Thank you. And this question, I think that it could relate both of you. I think Angel, this is directed towards you, but I think you both probably could put some input on this. And this is asking, how can we practice empathetic listening these days related to this year's trauma? And they're saying the twin pandemics of racism and COVID. And I was just thinking about this in relation to Dr. Allen opened with the acknowledgement of what happened with the API, the Asian American community. So we're seeing all these different racial traumas going on at the same time with the COVID. All of the Black men who've been killed and women as well. So Angel, what are your some thoughts related to that?
Empathic listening is something that is a skill that can be learned, but I do think it requires professional training. It requires for you to have a degree in that in order for you to understand how to do it and the pre-existing conditions for the person that's in front of you that's telling the story. So for people that want to try to practice a limited form of empathic listening, is important to understand where your personal boundaries are and how you can sit with the person, and knowing when you start to tap out and knowing that it's okay. Because with the pandemic, I think everybody's just working with a lot less, and we're expected to give 1,000% with outcome. There are people expected to still show up to work with a pandemic happening, putting themselves at risk, putting their families at risk, but they're the last one to get the vaccine. And what you see is the systemic pieces being put more out on Front Street for people to be able to have to show up at work, be on time, be cordial, be polite. No one wants to hear about the fact that you're financially struggling pre-pandemic and current pandemic. You're putting yourself at risk for COVID-19. And then when it comes to getting vaccinated, you're the last person to get it. And so we're all working with less. So acknowledging that for what it is and not trying to make it something that it isn't is important, that self-awareness and what it looks like for you. And if you acknowledge that and still want to step into empathic listening, understand that there's a lot of personal limitations that you just might have. So if you're having your own personal stress, you do want to go ahead and step back and take care of yourself first, because you might not be able to be fully present for someone else's pain if you haven't tended to yourself. Self-care is a very broad thing that it can include things that makes us feel good, but therapy is a part of self-care too. Self-reflection and accountability and practicing new skills and new mental health and behavioral habits, that's also part of self-care. That could be uncomfortable, but it's going to require some level of changes in practice. So I think the most important piece to empathic listening, before you get to that piece, to be able to sit in someone else's grief and discomfort, you have to attend to your own discomfort first, and then ask yourself, are you giving yourself attention for your own level of grief and pain and anger to exist? Are you making time for it? Are you creating spaces of support and help for yourself? And if you're doing those things and you're checking off that list, and then you say, okay, I think I'm able to listen for about 10 minutes, and then being clear about what you can offer and what that limitation is. So whoever might need you, they won't personalize it to think it's something wrong with me. Mm-hmm. So if I'm able to offer you 10 minutes because I just got off of work, then me being clear to you about that creates a safe environment, and it lets you know what I'm able to do. But I'm able to only articulate that once I'm clear about where I am in my own personal expectations, limitations, and how I'm serving those pieces first in order to serve someone else.
I really like the idea of that time limit, being clear about that. Michelle, did you want to add anything to that?
She answered so well, but I'd say also to be aware of your own personal biases as well. Mm-hmm. Just being honest about what are you truly thinking. People have so many different viewpoints: to wear the mask, not wear the mask, get vaccinated, not get vaccinated, personal biases, racial biases. Being aware, really self-aware of what your own biases are, and being true and honest with yourself. We've had so many discussions on cultural awareness and where does it go. So once I'm really going to take this information, what do I plan to do with it? Because it starts in the home. So what is it that I can do, a small thing that I can do and be truly genuine about it. And that at the end of the day, to accept that we are all human. We are all have been affected in some way, form, or another. And so when we get down to the basics of what it is, just really knowing what our true biases are, and really knowing, okay, so what would I plan to do if I'm listening, what is it that I plan to do to be the change or be the difference as well.
Mhm. That's wonderful. And there was a question here that that is just kind of pulling back and just checking with both of you of how you got into this line of work that you're interested in. How did you, Angel, begin this research? What got you into it? And also, Michelle, what made you want to pursue this, looking specifically at the Superwoman syndrome? So maybe I'll start with Angel, if you wouldn't mind.
Sure. And so one of the very first early memories I have is going to Baltimore to the Blacks and Wax Museum, and they had different exhibits of different Black heroes and historical figures. But at the bottom of the museum, they also had an exhibit of lynchings that was very graphic. And I think I went when I was 12 years old, and it was one of those things that was shocking, but it was like, how could another person participate in taking another body part from another person? I didn't understand that. I couldn't compute that. And so by the time I went to South Carolina State, there was an instructor, her name was Marie Artis, and she told me that the first Black social worker was Ida B. Wells. And then she highlighted, because she was able to collect statistical information about the traumatic events that was happening in our community in relation to lynching, even though Ida B. Wells was a journalist. But the work that she was doing for the advocacy of the Black community fit along lines closely with what social work was doing. And for me, that sparked the interest to understand a little bit more about her work. And then fast forward to more current times, with just being a part of documentaries that talked about the intersections of African-American slavery as well as Native American ancestry and indigenous communities, and going out to more rural places in Georgia. It just sparked my interest to continue the research about what kind of mind is able to participate in an extreme violent event and still go home and to their family and still love on people and still give advice and be available to someone, but also can encourage other people to kill a person that they know in their community. And so I was interested in trying to understand how a mind can work in that way, to be involved in direct and gruesome levels of violence against a certain group of people that just look a certain way, and then continue to appear as though they have met all of their developmental skills everywhere else. And so being able to connect the psychological aspect and psychological theories to what kind of brain development that looks like, what kind of human development goes along with someone who is perpetuating extreme levels of violence against Black people, wanting to understand that. And so with more people doing presentations about generational trauma, picking a specific event to say, well, lynchings after the Civil War happened rapidly, and there were a lot of them that were not documented. So what happens when you hone in on lynchings that occurred in a state like Mississippi, and you connect that to mental health diagnosis and substance abuse in current times, and look at those statistics and link those two things, and basing that off of theory and practice, can you make a connection with communities experiencing lynchings and community endorsed state sanctioned violence, and how that contributes to the mental health of the Black community today, and how that contributes to the impediments of the white community today.
Mm-hmm, mm-hmm. And it's so interesting to think about how that intergenerational trauma that you're speaking of connects to what Michelle is talking about. You can see the impact of that generation to generation, and with women having to deal with this. Michelle, talk a little bit about how you got into looking at this.
Like Angel talked about, of just looking at historically, just in conversation with friends of the stress that they deal with, and they would say, well, I'm okay, I'll make it through, or, and just looking at, even with conversations with my mom, I was like, it's something that, even with her dealing with her carrying the weight, and due to her carrying weight, she had to be hospitalized for to get clarity mental health wise. It really pushed me to a point to really look at, okay, what is it that's truly going on, that we feel like that we can't talk, that we feel like we have to be strong, that we feel like we have to have it together all the time. So it caused me to do a little deeper look into, from a perspective of how generationally, how we are taught that even though we may be exposed to trauma, many of my friends are people that I know have been exposed to sexual abuse, from family members, and you're taught to just, well, not to go to Uncle so-and-so house, but you can't say anything about it, or no charges will ever pressed, so you start looking at those things, you're wondering, okay, why is it that we feel like we have to continually be this strong person? And even with my own self, I had to realize that I couldn't wear my cape all the time. And I had to really, as a counselor, as a minister, as all of those things that's supposed to be vital and important, supposed to have it all together, you have to do those things to take care of yourself. So that's why I want to bring it out, to say that it is okay to be vulnerable. It is okay to not be okay. It is okay to get help, because many people in the African American community do not trust. They don't have a lot of representation of African American therapists, counselors, psychologists. So they don't trust going to talk to someone. They want to talk to someone that they can relate to. So just being that advocate to say, hey, I'm here. We're here for you. I'm advocating for you. You don't have to have this. You can release. You have a place to exhale and release. So I wanted to be able to offer that safe space for them to be at a place where they can come in, let their hair down, and just release.
Thank you. And there's some questions here that are kind of asking you both for advice. And the first one, Angel, you were just kind of touching on this. It's related to thinking about white people. Like, for example, a lot of us, we're here on a campus, and a lot of us are professors. We teach students about some of these histories that you're talking about. And, so one of the questions they have here is if you have any recommendations for not traumatizing students while teaching about lynchings. And then also along with that is thinking about work being done on the impact, of white spectators, so thinking about whites positioning themselves and thinking about these issues, how they're dealing with it from an emotional or psychological level. And then also thinking about just the class in general, these younger people, and trying to teach them about these horrors, but in a way that, is not traumatizing.
Unfortunately, I would think the best way to completely just not traumatize someone is to just not talk about it. Mm-hmm. I don't recommend that completely, because to talk about slavery is also a traumatic event, but we somehow, we still walk through it. We walk through it slowly, but we also understand the necessity of talking about it. And even then, sometimes we talk about versions that we're comfortable with to not traumatize the audience, but the act of still talking about it can be traumatizing to some. And the most you could do, I would think, is to create like a precaution before going into the story of talking about lynching. So that could be of some help in terms of lynchings is such a left direction that some people that we've just generationally have not talked about. So you would have to have like a general interest and connecting that to your personal why in reference to how it could serve the larger aspect of history. But for me, if you're teaching lynchings to a body of students or professors and they don't want to be extremely traumatized, I would do some level of briefing before you go into the subject matter, and then possibly some grounding techniques that they could practice after the discussion is over in order to reconnect them to something in their direct environment, re-engaging them in the five senses in terms of something that they could smell, touch, see, things like that, to just kind of connect them to their current environment to kind of calm down a little bit. And then also talk a little bit about triggers, even before you're talking about something as extreme as lynching, just having like a precursor conversation about things that could trigger you in history, and maybe having an open discussion about that and connecting that to the emotional responses that people might have and what tends to come up and what are some thoughts associated with that. So maybe even talking about triggers and grounding techniques before talking about lynchings, then talking about maybe even a segment of lynchings and the history associated with that, and then maybe grounding techniques after. So it's a lot of, it's a level of skill-based self-care that probably would need to happen before and after in order to be able to talk about it in a time-limited sense, but then being able to remind people that if you want to do this work to talk about it, you can just either not talk about it at all, or to understand different grounding techniques to help reconnect you to your current reality, and then to understand that to talk about the horrors of this is helping someone else personally be able to grieve and heal, as extreme as it is, and to be able to eventually allow those things to be a little bit less scary the more you talk about it, and to be able to connect the dots with how you can have community healing in that space by walking through the pain and suffering. But there's no avenue to shortcut it. You have to walk through it, unfortunately. But when you walk through it and the willingness to do that, you can add things to it to still keep yourself whole, and you don't have to lose yourself in that.
Mm-hmm. Those are excellent. And I love that idea of the bringing it back to community healing, trying to find that some kind of outcome in there. Let's see, Michelle. So there was another question here in terms of advice from you. And this is one where they are asking about navigating some of these conversations about that you talked about with Black women. And this person says, I'm a Black woman who is surrounded by other powerful Black women, but it can be really difficult to talk about self-care, therapy, etc. So I think the question they're asking is, any advice in navigating these conversations with Black women?
One thing is to just be open and honest, how are you doing? But really, how are you doing? Those are the first two questions you can really ask a friend. If you are at a place you want to navigate these conversations, have a girl, we have a social distance time now, or a Zoom meeting. And really, when people talk about self-care and therapy, many people think about it's taboo or woo. It's really at a place where you're talking about self-care, make it engaging, make it fun. Have someone in a community to come and talk about it, or have a girls' game night out, or just having that time to be able to have that conversation, a sleepover, and everyone can bring their pajamas and just really have that time to just really relax and exhale, and just really bring out the importance of us, having these conversations, having these things of, yes, we are strong women, but also part of being strong is knowing when to stop. Part of being strong is knowing when I'm at my limit. Part of being strong is, for me, if I want to be this best and strong African-American woman, that I have to take this time out to pour into myself so I can pour out to other people. So having these conversations, you can get someone in the community that may be willing to come in and talk with you all about resources that are out there. Just have the conversation and open up with, them to have a time where they can just send in something anonymous. And they can do a slip if they don't feel comfortable in sharing it at the time. But it's all about setting the atmosphere and the tone. Always setting the atmosphere and the tone that they have a safe place to release. I am my sister's keeper. And what can we do to help one another?
Thank you so much.
I also had something I would like to add to that really quick, because I thought it was a really good question. But, as a professional, I have to do my own work as well in terms of evaluating spaces where I need personal support, evaluating my level of grief and anger, all these things associated in order to be able to service the client, being able to do my own personal work. But one of the things that I find to help me and that I've been able to navigate with clients with is to also evaluate the audience, because sometimes we can create a space of disappointment when we go to a person that we think should be emotionally available to us, because we might be emotionally available to them, but they might not being able to reciprocate. So being able to evaluate the audience, to know that you might have some friends that are really good to buddy up to do this, the self-care thing with. We like to get our nails done and pedicure, but they're not able to sit with me when I'm stressed out about work. And when I start talking about that, they kind of tap out. So that's the friend that you can do the self-care superficial stuff with, and it's great and it's fun, but that's what they're good for. But you might have a friend that might not do the pedicures and get their hair done. They might do that, but they're better for being able to sit with you in a hard decision and really unpack the stress that's associated with work and with your personal life, and being able to do the empathic listening, and might be able to take your lead in reference to, do you want my feedback? Do you need me just to listen? Are you just venting here? Whatever you need me to do, I'm available. That might be a separate person for that. So being able to evaluate, the people in your life are not going to be able to service all of the needs in your life, but understanding the things that they're available for to you, being able to appreciate that. But what we don't want is to keep going to a hardware store looking for bread kind of thing. You want to be able to know where you can get your needs met, who you can go to for that, and then evaluate the emotional safety and confidentiality that you have to be able to be completely vulnerable with them, because you might be surrounded with a lot of powerful African-American women where you work, but you might not necessarily talk to them about the therapy session you had last week. And that's okay. Even if you want to talk about like, well, I'm in therapy and that's a start for me, that's okay. But do you need to divulge details about the session? Probably not. There might not be the target audience for that, but your friend that you've known for 20 years, they might want to hear stuff like that and might provide a more caring space, a more loving space to hear it. So being able to evaluate the people in your life, what they're good for in reference to the connection that you have with them and what you need from them, because we don't want to place the inappropriate expectation that there's one person I'm going to get everything from.
Mhm.
Yeah.
That's wonderful advice from both. And I just wanted to thank you again, both of you, for being here with us and sharing your wisdom, really, things that we need to hear right now, because we're all going through a lot of craziness during the twin pandemics, as people were just talking about. And, we need this step back to kind of figure out how we fit into this whole thing, and how we take care of ourselves, and how we continue to be aware of this generational trauma that's really brought us to where we are now. But how do we take care of ourselves and in this point in time? So I want to thank you again for joining us today. And I think they're letting me conclude the whole session. So I just want to thank all of our audience who came and joined in with us. I know that there was a lot of interesting questions, and you guys really made this be a really great conversation. So I appreciate you being here with us today. Thank you.
And thank you again.
Thank you.
Thank you.